Here we are again in Uganda this year. We are here to start the implementation of the strategy for the improvement of hand hygiene in hospitals in the east of Uganda. We have chosen to actually do it in this part of Uganda because of the diversity of hospitals and also because we knew about the region and because we wanted to actually approach different type of hospitals. A major system change is needed. When I say a major system change, I mean we need to install alcohol-based handrub dispensers wherever needed. We need also to provide the sufficient amount of alcohol-based handrub as necessary to actually make sure that healthcare workers will never miss alcohol at the point of care when needed, and we need to make sure it is sustainable over time. So this would be the major impact of the intervention. Of course, we visited the Ministry of Health. We also visited the research center and the ethical committee that reviewed the protocol. We were really warmly welcomed everywhere. So it was a great pleasure to interact and to actually partner with all those colleagues and friends. The team asked us at the Ministry of Health, could you build up this intervention for the entire country? Actually, what we want to do is first to test the feasibility, validity and sustainability of the intervention in this part of the country before we could expand to the rest of the country. We actually visited hospitals in 4 districts, in Bale, in Kumi, in Tororo, and in Busia. Each time we selected hospitals that are either district hospitals, regional hospitals, or actually health centers. Why? Because we want to look at the feasibility and adaptability of the intervention in different size hospitals. So they are very different. There are places where, of course, there are a lot more procedures performed and a lot more healthcare workers to train than others. But really we wanted to see and have a perception of the difference that we could find in those different places. These hospitals, of course, will be model hospital in the future. Now remember that to promote the change in the behavior of the healthcare workers toward a better hand hygiene performance, you need essentially 2 elements. The first element, the alcohol-based handrub, must be available at the point of care. And the second element is, of course, the implementation of the education and the change in the behavior that will actually promote a better attitude. To ensure the system change would not tolerate system failure. System failure would mean that alcohol would suddenly not be available at the point of care. When we asked them the question, is alcohol handrub available in your institution? They all said, yes it is, but unfortunately we don't have enough. What we want is every single healthcare workers to benefit from the capacity to access at the point of care alcohol-based handrub. It would be impossible to ensure universal system change without producing the alcohol locally. You could produce alcohol-based handrub locally out of sugarcane. We visited again the Saraya company that actually is producing alcohol-based handrub out of sugarcane byproducts in Jinja in the middle of Uganda. It's always a great pleasure to visit the Kakira Sugar Factory. It's a unique factory as far as I know, because first of all, it's a very huge complex. The Kakira owners have decided not to include too much mechanics. Why? Because you want to save the jobs first. Almost 10,000 employees working in the factories and their families living with them, which means almost 45,000 people living in a large community in 22 different villages all around the places. It's really something unique that you can see. It's a real social business venture. We have been working on producing the alcohol, making sure it would be available. Now we are into the human factor that we are ready to implement it all over the place in this eastern part of Africa. This is an absolutely great advance for healthcare in Africa and of course for the people of Uganda.